Good afternoon, Dr. Hollenbach. How are you today?
Good, thank you.
I'm just here today, and you've been using the Promoitalia threads for quite some time, and now that the absorbables are available in Australia, we'd like to hear from you, and I'm sure your patients would like to hear a little bit about the Promoitalia thread lift and the fact that they're absorbable, makes them quite an advantage. What's your opinion on this?
Well, I think that I wouldn't use any other threads other than absorbable now that I have used them for quite a while. I think that one of the big problems with threads was the propensity for the body to try and expel them as they inside a foreign body reaction, but with the absorbable component we don't have that problem nearly as much. I think that also because of the absorbability of the threads, it means that we're less likely to have any granulomas or lumpiness, and we can assure a smooth contour and a natural look.
So basically some of the main benefits of a thread lift, in comparison to a facelift, would be that it's less invasive. Is there any other advantages?
Well, I tell my patients, many patients come in looking for at least a mini facelift and or a cheek lift or a jawline lift or a brow lift, and I think that from my point of view now, I think threads offer a very good alternative. I think that you can provide as much of a lift as you can with the other procedures. Of course, there's less downtime, there's less morbidity, there's less risk of any untoward reactions or side effects or complications, and the cost is also more favourable, so that in particular, as opposed to a full facelift, which scares a lot of patients off, a lot of my clients are much more comfortable with the thought of having threads. Just in relation to brows, I've been using many techniques over the years, all of which are much more invasive than threads, and I can honestly say that the result that I'm achieving with threads is as good as any of the other techniques I've employed in the past, and it's much easier for me and much easier for the patient.
Yes, I can understand that, because especially with these new ones that dissolve over time, you're actually using a foreign body reaction, and basically the body is actually creating much more collagen. Is that correct?
Well, you people tell us this. I'm not sure if the body makes a lot more collagen or not, but I think that the threads achieved their result by creating a little foreign body reaction in amongst the collagen. So I tell my patients it's like the barbs are like having little spot welds, and when the threads absorb, there's a little spot weld in that area to keep the tissues where we want them to be.
So it's realigning the tissue, and basically a patient can, would you say, take a few years off their age?
I think definitely. I think the threads can definitely take a few years off their age, and I think that the techniques are constantly changing, and it's quite exciting because we're developing new techniques and achieving even greater sort of benefits for our patients because of those new techniques.
Now there's a few areas that you can actually use the threads on. What would you say the main successful areas for the revitalizing thread lifts are?
Well, obviously, being an oculoplastic surgeon, my areas of interest are the upper face, and especially around the eyelids and the brows. And I think that, as I said before, using the threads for brow lifts offers certain advantages over any other techniques, and I think it's now my technique of choice for cheeks. I think that it's a much better technique than using cheek implants, for instance, and although we still use fillers around the cheek, I think it provides very good scaffolding for those fillers. It's obviously also really good for the double chins and the jowls and the jawlines, and I think that's another area where I've actually not had any surgical training, but I'm getting great results just by using threads alone.
Yeah, it's quite amazing where it's come to now. How long would the procedure take, or does it sort of depend on what you're doing?
Well, it depends on the patients. I think that if the patients are, for instance, having their cheeks and their jowls done, we can do that between an hour and an hour and a half, generally speaking. I have spent more than 2 hours on patients needing more threads, or if a patient needs a brow lift, we can often do that in less than an hour.
Yes, yes. And you know, obviously patients are concerned about pain, and you know, it's under local anaesthetic. So how much pain would they actually go through, and you know, would they feel after they've had the procedure?
Well, that's a loaded question, actually. More of my patients are having threads now with general anaesthetics, actually. I think that with installation of local anaesthetic, whilst they don't feel the procedure from that point on, it's actually having the local anaesthetic, which is, I think, quite painful. And I think if I'm only doing a few threads, that's fine, but if I'm doing the cheeks and the jowls and the brows all in one, rather than having all local anaesthetic, I think they're just much better off having a general. But you can do them under local
anaesthetic, yes. But at the end of the day, you want patient comfort.
Well, yes. If it was me, I'd have a general. If we don't.
Okay, yes, and I tend to agree with you. I think if it's patient comfort at the end of the day, you'll love the experience, and then you'll go and tell lots of people. Okay, so the recovery time for it, what would you expect?
Well, that's always been a surprise for me, and of course, when I started doing them, you'd see the amount of puffiness afterwards, and you think, gee whiz, that will take a long time to settle down. But in my experience, most of the patients look fantastic after a week. I think that the downtime is definitely less than a week.
Yes, of course.
Unless there's been bruising or anything untoward, but that's not very common.
Okay. Well, that's great. Now, your surgery, you're in Newcastle, is that right?
Yes.
And what is the name of your surgery?
Preface.
And so if a patient was wanting to come and see you, they can just make an appointment and come and have a consultation, and you'll explain to them exactly what's required.
Yes, I have a policy in our practice here where the first consultation is always with me, so I see every patient rather than sending them off to have treatment. And I go through all the different procedures and treatments we offer here, and for instance, if they're interested in threads, I'll go through how the threads work, how the procedure's performed, what's the likely outcome and how long they'll last, and all those things, so the patient has a clear understanding before they leave.
Oh, that's fantastic. Yeah, because that's exactly what the patient wants. They want to understand exactly everything that's going on. So is there anything else you would say to a patient that was interested in having threads?
Well, I think that one of the things that has worked against threads is perhaps that they didn't have a great name when they started, and I think that like any new technique, it passes through a series of developments, and threads is no different. And I think one of the problems with threads in the first instance was the type of barbs, which perhaps didn't grab the tissues as well as they might hope to, and so the longevity of the results was rather short-lived, and often it looked great for a few months, but after a year you'd hardly know that the procedure had been performed. I think one of the other problems was what we talked about before, in that the non-absorbable threads could lead to foreign body reactions, granulomas, and sometimes the threads would extrude and have to be taken out, and so the whole effect would be lost at that time. And I think that the developments that we've had with the Promoitalia absorbable threads have negated all these things, and I think we can safely say to our patients that they should get an effect for 2 to 3 years. I know that the Italians are quoting 5 years, but I haven't been doing it long enough, and that may well be true, but I think 2 or 3 years is what I'm telling my patients at the moment.
Fantastic. Well, it's been really great talking to you today, and you know, I know that you'll be doing a lot more threads in the future, and I want to thank you very, very much for having a chat today.
You're welcome.